There's two live oaks. There's a live oak along the coast where there's a lot of wealthy families and beautiful oceanfront homes. And then a stone's throw away, there are mobile home parks.
We have a lot of immigrant families, mostly Latino. A lot of them are English language learners.
We're taking care of most of the medically complex kids in our area. Been a lot of kids with attention problems, self-regulation problems, and then sometimes with pure learning problems. Poor attention is just a symptom. It's not a diagnosis.
Center for Care Innovations really created that supportive space for us to be creative and innovate and try new solutions.
The CASE conference is a chance for the medical world and the educational world to totally understand each other.
When you think about child development and improving the health and well-being of children, you really need to focus on the child in her environment, in her family life, in her school. Primary care providers only get a snapshot. They see a child for, 30 minutes perhaps, whereas a teacher sees that child for 6 to 7 hours, 5 days a week. By bringing those two institutions together, you get a whole picture.
If you are trying to teach a child who has something like chronic dental problems or chronic ear infections, chronic anything, you have to get that treated before you can teach.
In preparation for these conferences, I really want to find out what the family wants to happen. So I just get out my cell phone and make a little voice memo. Tell us about your child and tell us what you hope this conference might help you with. And we're going to use it to open the conference.
When he plays those tapes of the parents' hopes and dreams and wishes for their student, it's really meaningful and it's coming to me from a different perspective.
I want to help my son to grow, to develop socially, emotionally. I want him to be happy.
Buenas personas, that they want their children to be the kind of people who give back to their community, that look out for others. So we think that's a really special part of what we're trying to create here, is not only that focus on academics and medical health, physical health, but really that social, emotional well-being and connection to community.
Sitting in the CASE conference, you learn so much about a child from a 360-degree perspective. To hear social workers speaking with a behavioral developmental specialist, speaking with teachers, speaking with the pediatrician, and then bringing all that information together, it's really eye-opening.
It's been so impactful to just be asked my opinion after all these years, to have somebody who wants to include me in something like this.
By having these CASE conferences, it allows for us to go into so much more depth of what those needs are versus the typical healthcare plan being established by just a piece of paper that is sent home, goes to the pediatrician, that piece of paper comes back, and there's no actual dialogue to clarify things. So having the conference where you have a face-to-face discussion and you can ask questions and you can give feedback, it's remarkable.
Everybody wants to be here. I mean, most people don't like meetings. I really don't like meetings at all, but this is a meeting that I crave.
We try to identify who are our high-risk patients. And if we're looking with the school, why don't we ask the school, who are their high-risk patients? And this is a perfect example of how we're in our own little worlds. It was shocking. The lists were almost completely different. It was sort of an aha moment. Sure, we do the medical high risk, but psychosocial, emotional development high risk is equally important and something that we were not working as well in until we made this school partnership.
The very first CASE conference that we had, we'd literally done everything that we possibly could, above and beyond even the regular school day, being involved with the family, going to homes, all of that, and not seeing the results that we wanted to see for this particular child so that they could rise up to their amazing full potential. And so the idea that suddenly we have access to these incredible services that will really touch the whole child far beyond what we could do as the lone school site. So being able to go tandem and become a partnership was just an amazing gift.
Particularly for us in medicine, I really did not understand how little we knew about our patients. And then suddenly I hear from the teachers, what is this child like all day long? It's a wealth of information that I didn't have.